Communicable and infectious disease risks is this chapter, and it's kind of nice to just mention what a communicable disease is, which I hate that word because it is totally a tongue tire. But communicable diseases are the same as infectious disease, so they are spread from one person to another through a variety of ways. It could be blood, body fluids, breathing in airborne virus, or even being bitten by an insect like West Nile virus. So that's what this chapter covers. And of course, we're going to go through some objectives of this lecture. And the first one is to describe the history of HIV and each stage and what the primary or the public health nurse would do in each stage for education. Explain clinical signs of selected communicable diseases. So we just have a handful of them that we are seeing an upward trend in the U.S., and those are the ones that we are going to focus on today, since there are so many diseases out there. Evaluate the trends of the incidence of HIV, STDs, hepatitis, TB, and also identify groups that are at the greatest risk. Analyze behaviors that place people at risk for these diseases. Evaluate nursing activities to prevent and control these diseases as a primary public health nurse. And explain the various roles of nurses in providing care for these. So, first of all, we should go through the history of HIV. This screen is basically a summary of what we are going to cover for the topic of HIV first. So, natural history of HIV, transmission, epidemiology of the HIV and AIDS in the U.S., HIV surveillance, testing, perinatal and pediatric HIV infection, AIDS in the community, and the resources. So, history of HIV. History of HIV shows 3 stages. Your primary infection stage is within about a month of contracting the virus. So during primary infection, the individual usually feels similar to the symptoms of having mono. So they're going to have a fever, fatigue, maybe a sore throat, headache, rash, that type of symptoms, or nothing at all even. Sometimes these individuals, when they get infected with HIV, don't even notice it in the first month. But usually this primary infection stage is that beginning stage where HIV is introduced into the body, and for that first month is the primary infection stage where they might have those mono-like symptoms. Clinical latency is when your body shows no symptoms at all, so this could be several years. Over these years, the body slowly diminishes their immune system, which is why if we can catch HIV during this primary infection phase or clinical latency phase, it is super beneficial to use highly active antiretroviral therapy. What that does is it uses treatment that combines 3 or more drugs to treat HIV, and it basically stops the virus from copying itself. So very, very effective therapy for this stage. However, the downer of primary infection stage is if they do not have any symptoms during that stage, then they don't go into the doctor, for example, and they don't get treated or tested. Another downer is that if you are tested in the primary infection stage, the HIV does not usually show up on blood tests at that time. So the actual catch here is if we can't actually diagnose them in some way after primary infection stage, that's when it can potentially get to the AIDS stage before we notice that they have HIV. So symptomatic diseases, which is the AIDS stage, is the next stage of the HIV history. This is the stage where basically it is the result of the damage that the HIV has caused over the years. So acquired immunodeficiency syndrome is what AIDS stands for, and a way to determine if it is advanced enough to the AIDS level is that CD4 count, which is those white blood cells that fight your infection, would end up being less than 200 per mil with documented HIV infection. AIDS-related opportunist infections would include pneumonia, oral candidiasis, pulmonary tuberculosis, invasive cervical cancer, even salmonella infection is one. So when we talk about these opportunistic infections, you want to remember that these are infections that occur more often or more severely in people with immune systems that are compromised. So these are just infections that are out there in the world that you and I might get and be able to kick really quickly, whereas an individual with AIDS could get this frequently and over again and struggle with the same thing. So pneumonia is a very, very common one. Transmission, as you are probably aware, since HIV is something we've been educated on over the years, is through exposure to blood, semen, transplanted organs, vaginal secretions, and breast milk. So the way that these would occur is most commonly through blood, sexual, or needle sharing exposure with an HIV infected individual that is at risk for contracting the virus. Not transmitted through casual contact, so hugging, touching someone, or through mosquitoes or insects. So let's talk about your role as a public health nurse in this process so far. So when you are in the transmission phase, think of all the things that you could educate others of. Whether it be somebody that is already infected with HIV, you as the public health nurse would be in the role of educating the family members and that individual with HIV that this is not transmitted through casual contact. You can still hug and cuddle with somebody. I mean, none of that is going to be transmitted through casual contact. That is very important for individuals to know. But then also, as a preventative measure, just being out there as a public health nurse prior to transmission, making sure individuals that are possibly coming into the clinic or other areas and have had a history of maybe unsafe sex, making sure that they know about different diseases and the routes to prevent them from happening. From an epidemiology standpoint with HIV and AIDS, the first cases of AIDS were in 1981. Worldwide, we have 35.3 million people that are living with HIV infection right now, and 70% of those 35.3 million are in the sub-Saharan Africa area. The epidemic is also starting to grow to Central Asia, the Middle East, and Eastern Europe, which is why the treatment for HIV infection is such a high priority. We need to determine where this HIV is located and ensure that we're providing early treatment and early education to where it does not spread. Prevalence of AIDS has greatly increased over the years, and that is due to our effective treatments and getting ahead of catching the HIV prior to. So remember, prevalence is the number of cases that are alive in the world or US area. So people are living a lot longer with AIDS because of treatments improving over the years. So let's talk about HIV testing. The HIV antibody test is commonly the first one that is utilized. What it does is it indicates the presence of the antibody to HIV, but the downer to that is it doesn't reveal whether the individual has symptomatic AIDS, or it also does not isolate the actual virus. So you would need to use a second test, which is the Western blot test, to confirm and minimize the false positive option or possibility of the HIV antibody test itself. The enzyme-linked immunosorbent assay, I can never say that right, screens blood and other donor products as well. It is a form of this HIV antibody test. So then when you're thinking of these two tests, the other thing you want to think of as a public health nurse is how can we make sure that this is something that's available to people to where they can come in and it can be private and anonymous. That would be your voluntary screening, finding ways to allow the community to be screened without having to, by keeping it anonymous, basically. The downer of anonymous testing is then you as a public health nurse can't follow up and help get that individual to further testing and further follow up with a physician, for example. So that would be the downer of voluntary screening. There are other versions of voluntary screening, which would be your rapid HIV antibody test that you do orally. I don't know if you've ever heard of those, but you can look them up online, order them, they can get sent to you. You would get your results within 20 minutes, and that would also be another anonymous test that could be an option for someone, especially if they're afraid of getting their blood drawn. And then routine testing, an example of that would be any pregnant individual usually is screened for HIV just to be safe while they are pregnant. They get their blood drawn for that. So that would be one example of many of routine testing as well for HIV. Routine testing is also recommended for all clients attending health department, STD clinics, family planning clinics, community health centers, and primary care offices. So in reference to what I just previously mentioned on the other slide, routine HIV testing is part of prenatal care pretty much everywhere in the US. So When we think of perinatal and pediatric HIV infection, when you're considering the transmission process, usually almost all of HIV infection in children is occurred during pregnancy for them, or during the delivery process, or during breastfeeding, which is hard to think about because sometimes those many of those factors, labor and delivery and breastfeeding, as long as we know that they are HIV positive as a parent, we're able to hopefully prevent that from happening with the delivery process and also preventing them from breastfeeding. So then that narrows it down to just the pregnancy portion of the baby possibly acquiring the HIV infection. So the importance of that HIV testing during prenatal care is huge. Pediatric infection, despite having an HIV-infected mother, many children do not acquire AIDS, thankfully. However, one or more parents may die, which would also obviously indirectly affect the health of the child. A nice side note to this, though, is that the effectiveness of antiretroviral therapy, oh, I got it right this time. I always tongue-tie that one, in pregnant women and newborns is it's preventing transmission from the mother to the fetus or infant, and it's made a huge decline in pediatric HIV rates, which is wonderful. One of the biggest parts of being a public health nurse is making sure to know your resources and be able to direct your patients into the right direction of help further from whatever it is that they need. So for HIV or AIDS individuals, you would want to make sure to give them the correct service organizations that would help them further, and then also the right websites and toll-free phone numbers. So an example for South Dakota, going to the South Dakota Department of Health website would be a great one. And then also even just calling the city's Department of Health. So calling the city's health department for Sioux Falls, they would be able to direct you on whatever concern it is that you're trying to find more information for your individual that you're helping. They would be able to direct you at that time to the correctly funded organizations that would be able to help them further. And remember that funding, for example, changes so often that the resources are going to be also changing quite frequently, dependent on what you're looking for. So that's why you want to utilize those individuals in your city and your state to be able to direct you further to help your patient advance. One more thing, I'm going to stop this recording to try to keep it under 15 minutes and give you a part 2 of chapter 14. So that's why it's cutting off, and this is a good spot to stop. But also, I will be sending an email out that has a great list of resources for South Dakota for right now, and it also gets updated routinely depending on where the funding is being allocated. So be sure to look for that email after this.